One of the important effect of this corona or COVID virus is on blood clotting. So it has got a lot of afflicted part like lungs are affected and even circulation is affected and all those things. And we have seen many patients after COVID vaccination sometimes or even after treatment or even literally getting afflicted with that. Once they are free from the infection also, suddenly they got collapsed and they developed some ischemia, some ulcerations or gangrenous type things and these things. All these things have been reported. So very clearly, the effect of particularly the coronavirus is also seen on blood clot and blood circulation and system. So keeping in this mind, Vasa is one of the drug which is very potent on the action of Raktapitta Hara. So very clearly, Vasa helps in agglutination of platelets, or even it is very good for clotting. And the reason whenever there is a bleeding, we try to use Vasa Patra Swarasa and also Durva Patra Swarasa. So these type of drugs which tend to help in clotting also disturbs the circulation or hampers the circulation, which is already hampered, it supports that. So, in a clinician, it is our choice. It should be we try to select the drugs which won't disturb or damage further. So, being keeping these things in mind, this Vasa is one of the important Rakta Pitta Hara Dravya and it helps in clotting of the blood. Better we should avoid it because there are people with COVID, they end up with some sudden myocardial infarction and people have lost their limbs because of clotting and they're amputated and even all these issues were there. So it is better to avoid Vasa in this condition. Even though Vasa is on a wonder drug, but still it has a special potency and an activity which may come in the way of our clinical treatment, particularly with this COVID season and COVID infections. So it is better when those patients, for a time being, it is better to avoid Vasa.
Are you open to recommending, say, Vasa Valeha, which contains pipali, which could negate that Rakta Pitta Hara action, or vasoconstriction action, or do you want to avoid all Vasa medicines?
Generally, now when COVID things are there, people are trying to go with the single herbs. Very rarely that mass version and such type of combinations have been taken care of. So when we have a better drugs in our disposal, why we want to stick on to Vasa? If something is there, better to avoid it because it is spectacle. I mean, it is open for discussion and it is open for even studies because this area is still a gray area. But conceptually, this is typically a Raktapitta Hara Dravya. Better to avoid this is a good keeping in mind, and it's a good thing. Whether people will counteract the effect of Vasa, that is another once again a point of debate, and it should be observed in a thing. And when two drugs are given and it is going, one is hampering, the other one is avoiding that. When these two drugs unnecessarily combating against one another instead of giving a good result to the body, I don't know. I don't think so. Why we should go and stick on to those type of drugs? We have got still better drugs like those which are penetrative and clearing the kapha and clearing the shrotases, like Maricha is there, Pipali is there, Shunti is there, and even Estimadu, Guduchi, Kalamega, Tulsi. There are plenty of drugs are there. We can use those drugs which can even come over kapha as well as it is a very good one. Avoiding even it breaks open the clot formation if it has happens. So that's the reason I usually avoid Vasa in patients with COVID or suspected COVID cases and in infections, and those who have a tendency of myocardial infarction of previous history and those who have a family history of myocardial infarction and those who have a tendency of venous insufficiency and already they have got some static dermatitis or somewhere I could find there is a deficiency in the status of circulation or blood circulation is hampered because of various reasons. In those type of persons, I usually avoid giving Vasa because of these reasons.